a really positive story out of the MUHC, which has some really fantastic researchers. This is about immunotherapy, which I have to say,
Mm-hmm.
I'm not sure my dad would be with us if it wasn't for immunotherapy. It
Mm-hmm.
really did a great job on his prostate cancer. And this application is about lung cancer now. Some new treatment is on the way. A new clinical trial is happening in Montreal. That we hope is going to slow the cancer progression significantly in lung cancer patients. Dr. Jonathan Spicer is the study's lead author and a chief surgeon at the MUHC. Dr. Spicer, welcome.
Hi, how are you?
Good, how are you?
Thanks for having me on.
Hi there.
So, can you first explain what immunotherapy is and why is it different from traditional cancer therapies?
Yeah, it's a great question. A lot of our treatments are really aimed at the cancer cells themselves. Chemotherapy, for example, is targeting cancers, the cells that reproduce rapidly, but we also have some of those cells in our body that are normal. And so the action is not always very well targeted, which explains why there's often side effects with these kinds of treatments. But with immunotherapy, essentially what we're doing is we're helping your body's own immune system recognize and attack the cancer, which it should be doing, but cancers develop ways of putting your immune system to sleep, and we now have medications that help wake that up, and so it allows a very powerful effect on the cancer.
So rather than attacking the cancer cells, it's about stimulating the immune system to do what it's supposed to do. Is that correct?
Yeah,
Okay.
that's sort of I think the simple way of explaining it.
Mm-hmm.
Whenever we have foreign invaders in our body, whether it's a bacteria or a virus, or cells that have become abnormal, like a cancer, our immune system should really recognize those and destroy them. And our immune system is quite good at doing that. But cancers, as they grow, develop ways of putting our immune system to sleep. We figured out how they do that, and we have medications that target those pathways so that we can reverse that and sort of unleash the power of the immune system on the cancer.
Lung cancer in particular can get really tricky. Is that why immunotherapy is especially promising for this form of cancer?
That's an important point. Not all cancers respond well to immunotherapy, but lung cancer is one of them, one of the ones where it is quite effective. And what was special about this study is that we're bringing these treatments into the earlier stages of the disease.
Mm-hmm.
We've proven a few years ago now that immunotherapy really can help patients with cancers that have spread throughout the body. But very few of those patients will be cured. But now when we have the opportunity to combine a treatment like immunotherapy, which goes everywhere in the body, with surgery, we can really increase the cure rates.
Can you talk to us a little bit about that clinical trial and what the survival rate, the odds of survival, how they compared to between patients who received the immunotherapy treatment and those who did not?
Yeah, so this is in this trial, what we did is we gave immunotherapy in combination with chemotherapy
Okay.
before surgery in patients who were thought to be operable, meaning that their cancers could be removed surgically, and then gave it afterwards as well, and compared that to patients who would only get the chemo and the surgery, which was the previous standard of care.
Right.
And about 20% more patients at 2 years were alive without any evidence of disease, which is quite a significant improvement upon what we were able to achieve in the past. So this is another step in the right direction for lung cancer patients.
In the last few years, for obvious reasons, COVID, there's been a lot of chatter about gain of function research. Is this research part of that concept that is empowering some viruses to do good instead of evil, or is that a different concept?
Yeah, it's not really in that quite the same realm. There are new kinds of therapies coming about, and will be other types of treatments that they're kind of using the same technology that we used for the COVID vaccine, but now in the context of cancer. But we're a few years off from knowing whether those treatments really help or not.
Dr. Spicer, you mentioned a couple of sort of parameters of this test. One of them is that it was used to fight early stage lung cancer, and the other one was that the lung cancer was operable. Is there any way that this could be applied to later stage cancers or inoperable cancers with any success? Do you see that being a pathway for this particular treatment?
Oh, it already is,
Okay.
and so that's something that we've already established, is that there's quite a number of patients with different kinds of cancers. The common ones are cancers like lung, melanoma, and a few others that really respond very well. The patients do much better when they receive immunotherapy in the context of these, inoperable metastatic cancers.
Mm-hmm.
But what we didn't know is whether adding these medications to patients who could be operated would improve things. Because the problem is that we will operate on someone, we hope that everything has been removed, but often cells that our scans can't see have made their way out of the lung and elsewhere in the body.
Mm.
And so we need to add additional treatments above the surgery to really be able to increase the cure rates. And so that's what we're trying to do, along with screening programs, to find patients with earlier stages of disease that can be treated with curative therapies like surgery or radiation. We add these other treatments in the hopes that they get more people to be completely rid of the disease.
In terms of treatment, obviously you mentioned radiation. Chemotherapy comes to mind. Very painful, of course. People in my life have been through chemotherapy recently, and it's not fun. This is a lot easier on the body, right?
Well, in this particular trial, at least the portion before the operation, patients receive the immunotherapy with the chemo, and chemo still remains a very important part of the treatment. But there's a lot of value in going through that trouble if you'll be cured. You know what I mean? And so, of course, to get chemo and to suffer from all its complications, if it's not with the objective of curing the disease, is a little bit of a more problematic issue. But here it's the combination of chemotherapy with immunotherapy really has a lot of synergy and helps eliminate the cancer cells more effectively.
So there are different. It sounds like this is just yet another weapon to add to the arsenal. We have surgery, obviously being the first and foremost, and then chemotherapy and immunotherapy seems like it's something that is increasingly being used as part of the mix. I had a question about that. Is there, in terms from the patient perspective, when they receive a diagnosis, are they presented with different treatment options that may or may not include immunotherapy? How much does the patient have in terms of the type of treatment that they're going to be receiving, or is there sort of a menu of treatments that's prepared for them and presented to them depending on their diagnosis?
Yeah, that's a really great question. So I think the first thing to know is that we're becoming much more sophisticated in our ability to understand the biology of each person's cancer, and they are quite different. Lung cancers, like many cancers, is not just one disease, but rather a collection of rarer diseases that have very specific features. And so we're getting much better at identifying those features in a timely fashion, and then figuring out which of the various treatment options we have can help, cure the disease, and how to put those different treatments together in a manner that is easiest to tolerate for the patient and most effective to eradicate the disease. And that really means that people have to work as teams. So patients usually have more than one kind of doctor. They might need a surgeon, an oncologist, a radiation oncologist, and then a lot of people who are behind the scenes to make that happen. And we also need to be understanding of what the patient's objectives are. What are their goals? What are they prepared to accept in terms of risks and complications and all that sort of thing. And at the end of the day, it's the patient who decides.
Dr. Jonathan Spicer, chief surgeon and the study's author from the MUHC on this breakthrough or potential breakthrough for immunotherapy in lung cancer treatment. Thanks so much for your time.
It's my pleasure. Thanks for having me.
Thank you.